pain, we take NSAIDs painkiller without any doctor's prescription. So this is the major thing which damages our kidneys. Painkillers are the notorious for our kidney. Don't ever take painkillers without a doctor's prescription. The second thing which I on the daily basis see in a kidney patient is the history of Hakim medication. People come and tell us they are having a Hakim medication, steroids for a long time. When we ask them what are the reason of taking Hakim medication, they are just about we are taking it for joints pain, we are taking it for the upsetting of our stomach or any other reason. So avoid painkillers, Hakim medication, and yes, the most important thing is keep yourself hydrated. Keep yourself hydrated before you are doing a running job, a strenuous job, or a long period when you are sitting on a laptop. Keep yourself hydrated and always remember a rule of 30. If you are sitting for a 30-minute, you should walk for next 3 minutes.
Okay, as you are saying that we should avoid the painkillers, but mostly in our researchers and in academic, headache is the common issue. And for that, on our table, you will find the painkiller for headache, like for the body pain or this Multan and paracetamol, Disprin, this type of medicines we are commonly taking because of the headache in academic industry. So how we can avoid taking these? What we will do if we get headache in this?
Actually, all the medications have some safe dose range. Like if you are talking about Panadol or Ponstan or other NSAIDs, you can take, if you are having headache, you can take almost 2 doses in a day, not more than that. And most important thing is don't take these medications regularly. Like today I'm having headache, I took the 2 Panadols. Don't take it regular basis. Like some people come and say we are taking painkillers for like 2 years, 3 years, 4 years. They are worse for your kidneys. Believe me, they are damaging it so badly they can end stage renal disease. So the safest medication, especially in kidney patient, is Panadol and Tonoflex P. They are the safe medication for you and the people who are suffering from kidney diseases.
Okay, that's cool. But one thing is another. Most time we are getting our headache because of the blood pressure. Because blood pressure is the common thing nowadays. You can find not in the old ages, but in the youngsters also. Blood pressure is an issue. How harmful is the blood pressure for our kidneys?
Okay. First of all, I must correct you that blood pressure does not cause headache. There are some other comorbidities with blood pressure that may cause headache. As far as blood pressure is concerned, uncontrolled blood pressure is yes, dangerous for kidneys. They may result chronic kidney diseases or end stage renal diseases. So whenever you find someone at your home who are suffering from hypertension, high blood pressure, please go and get them checked with some physician and properly prescribe them with antihypertensive medication, because antihypertensive medication can prevent kidney diseases. Those people who have high blood pressure and now they are taking antihypertensive and with a good control of hypertension, I don't have seen they are suffering from any kidney diseases. But the people who are not taking their hypertensive medication, they are prone to have kidney diseases in future, maybe in 4 to 5 years after being diagnosed as the hypertensive patient.
Okay, so okay, for example, if someone is diagnosed with the kidney disease, so what are the common symptoms that a common person can understand? Okay, now I am getting the symptoms. So how can you tell us some of the common symptoms that a common person can understand?
Yes. The most common symptoms I have seen in patient is unexplained sudden body swelling. Like you don't explain that body swelling, you don't have any history of fall, don't have any history of bee sting or any other, like suddenly you have developed a body swelling. Or the other symptoms can be like suddenly a patient become anuric, like urine output decrease, or you are not having a urine at all in last 24 hours. Sudden development of vomiting, sudden loss of appetite, sudden uncontrolled hypertension in the patient who don't have any hypertensive history before. And especially the most important thing, the diabetic patient who are suffering from diabetes type 2, even though their diabetes is under control with insulin, they must get checkup for their kidney function almost 2 times in a year. Same for the cardiac patient, they should get their checkup of renal function 2 times in a year. And like you, I, and the other people who are normal, non-hypertensive, non-diabetic, we should get our renal functioning test once in a year.
Okay, our last question is that how can we keep our kidney healthy and working?
Obviously, by keep yourself hydrated. Drink water as much as you can, up to 2 liters in a day. If you have a if you have a non any if you don't have any problem in urine output, if you have a good urine output, please take 2 liter water in a day. And when you are sitting for a long time or sitting for a long laptop work, then please walk for at least 3 minutes after 30 minutes of sitting.
Thank you, Dr. Anam, for today's information.
Thank you.
I think this discussion was very important for us all because not only research is important, our health is also important. And sometimes we are too much busy in our research work and in our academics that we don't take care of our health. So we have to keep eye on our health also. We will also conduct a lot of webinars and seminars related to our health, and we will be informing you on time. So let's move towards our last two presentations. After that, we will announce the best